Perhaps there's nothing more disconcerting than noticing inexplicable changes occurring within your own body, especially when these changes signify the foreboding signs of an upcoming stroke. But don't worry, you don't have to navigate this path alone. We've explored this topic thoroughly and are here to assist you in identifying these signs up to 30 days before a potential stroke might occur. Welcome to a video brimming with insights about the 9 warning signs of a stroke, the astonishing indicators that will be revealed right here. Life can sometimes be too hectic for us to pay attention to the crucial messages our bodies are sending. Therefore, we invite you to take a moment, tune into your body, and become familiar with these signals. Don't miss the chance to learn about the precursor signs that you could notice 30 days before a stroke. This isn't just about protecting your overall health. It's a compassionate act of self-care. Let's delve into and share this video so that everyone around us can grasp these valuable signs and maintain a life of well-being and joy. Number 1 is high blood pressure. High blood pressure, often known as hypertension, is the most significant risk factor for stroke. Imagine blood pressure as a measure of the force with which your blood gently presses against the walls of your arteries as it circulates through your body, driven by your heart's rhythm. Normally, we consider blood pressure around 120/80, but if those numbers consistently exceed 140/90, it's an indication of high blood pressure. This condition isn't just about numbers, it's a gentle reminder that our blood vessels, including those connected to our brain, are under strain, causing the heart to work much harder to maintain blood circulation. High blood pressure and stroke are closely linked, but not in a good way. High blood pressure weakens vessel walls and can exacerbate common heart issues. It can also cause tiny clots or plaques to break off and block blood flow to the brain, a serious problem. Remember, the higher the blood pressure, the greater the risk of stroke. It's a call to action to keep those numbers in check. So why does high blood pressure even occur? It's a tricky one. There isn't often a single cause, but rather a mix of factors like family history, aging, weight, alcohol consumption, smoking, diabetes, and a high-sodium diet. However, we do have some control over this situation. Monitoring and managing blood pressure is crucial. Regular checkups with your doctor to keep an eye on those numbers are essential. Lifestyle changes also play a significant role. Regular exercise and maintaining a healthy weight can work wonders for your blood pressure. Number 2 is fatigue. Fatigue, the persistent feeling of tiredness, can surprisingly signal that a stroke might be on the horizon. It's like a quiet signal that deserves closer attention. Peeling back the layers, we find some intriguing connections. Fatigue isn't just about feeling tired. It's your body's way of indicating something might be wrong. And guess what? Lack of sleep is a major factor here, putting extra stress on your body's delicate balance. Stress itself plays a role in this story, silently impacting your well-being. To make things more complex, an unbalanced diet can disrupt your body's harmony and potentially increase the risk of a stroke. Number 3 is vision problems. Vision issues can provide important hints about potential strokes. They act as the body's way of raising a flag, indicating that blood flow to the brain might be compromised. When it comes to vision troubles, there's a range of common concerns to pay attention to. Blurriness, seeing double, or experiencing partial or complete loss of vision in one or both eyes are all part of this warning system. These are like little clues our body is giving us. Number 4 is sudden headaches. Those sudden, intense headaches? They're the body's way of waving a flag, especially if they come with other symptoms. Headaches come in all forms: tension, migraines, and classic sinusitis, all part of the headache family. But when it comes to severe headaches and strokes, there's a crucial connection we shouldn't ignore. If your head is pounding and other symptoms are present, it's like your body sending a coded message. By recognizing these signs, we can act quickly and potentially reduce the risk of a stroke. So let's give these signals the attention they deserve and stay on a healthy path. Number 5 is numbness or weakness in limbs. Feeling numb or experiencing weakness in your face, arms, or legs isn't just a fleeting sensation, especially when it relates to strokes. Let's explore the causes behind these sensations. Pinched nerves, arthritis, and even carpal tunnel syndrome are common culprits of numbness or weakness. However, when it comes to strokes, there's an important connection to recognize. Think of it as your body sending out clues that shouldn't be overlooked. If you notice these feelings, especially if they're accompanied by other signs, it's a call to take action. Number 6 is difficulty speaking. When it comes to strokes, difficulty speaking is a serious warning sign. It's like your body's way of signaling that something might be wrong with your brain. Stuttering, slurring your words, and struggling to find the right words are all part of the puzzle. It's as if your brain and tongue are out of sync. Understanding the connection between speech problems and the risk of stroke is crucial. Think of it as your body's way of sending important messages that need attention. If you encounter such challenges, especially if they come with other warning signs, it's a prompt to respond proactively. Number 7 is memory problems. For many, memory issues might seem like a normal part of aging. However, recent research indicates that memory loss can be a precursor to a stroke. A study by Erasmus University Rotterdam has examined the significance of memory lapses as potential indicators of other underlying health issues. Published in the journal Stroke, the findings reveal a noteworthy association between memory loss and an increased risk of stroke, particularly among individuals with higher education levels. While previous research highlighted that strokes can lead to memory impairments, this study explored whether cognitive difficulties could serve as early indicators of strokes. The results showed that individuals with higher education levels who reported experiencing memory lapses had a 39% higher likelihood of suffering a stroke. This group included individuals with college degrees or equivalent advanced vocational education. Number 8 is loss of balance. Loss of balance is a significant indicator of a potential stroke, as it often implies damage to the brain's coordination center. This center, located in the brain, harmonizes various sensory inputs and motor outputs to ensure smooth and precise movements. When this center is compromised, it can lead to a loss of equilibrium and balance. Several factors contribute to this, including inner ear problems, muscle weakness, and medication side effects. Inner ear problems, such as vestibular disorders, can disrupt the signals sent to the brain regarding spatial orientation and motion, directly impacting balance. Muscle weakness, often resulting from underlying health conditions, affects the body's ability to maintain stability and respond effectively to changes in position. Additionally, certain medications can cause side effects that compromise balance, including dizziness, drowsiness, or changes in blood pressure, all of which can increase the risk of falling and losing balance. It's important to note that these causes are not mutually exclusive. They can interact and exacerbate the risk of imbalance. Number 9 is nausea and vomiting. Nausea and vomiting can serve as warning signs of an impending stroke due to their association with disrupted blood flow to the brain. The brain relies on a constant and well-regulated supply of oxygen and nutrients delivered through the bloodstream. When this blood flow is compromised, as in a stroke, it can lead to various neurological symptoms, including nausea and vomiting. Nausea and vomiting result from the brain's response to altered blood flow and its impact on brain function. The brain's intricate control over bodily functions, including the digestive system, can be disrupted when its blood supply is compromised. This disruption can trigger the body's nausea and vomiting reflexes as the brain attempts to restore equilibrium. Several factors can cause nausea and vomiting, and it's important to consider the underlying causes in the context of stroke. While nausea and vomiting can indeed indicate an impending stroke, they are not exclusive indicators and can also arise from other conditions. For instance, food poisoning can irritate the stomach lining and trigger these symptoms. Viral infections, especially those affecting the gastrointestinal tract, can lead to similar reactions as the body attempts to expel the invading pathogens. Motion sickness, caused by conflicting signals from the eyes and the inner ear, can also induce nausea and vomiting. Currently, there is no empirical evidence suggesting the presence of precursory indicators months ahead of a stroke occurrence. Nonetheless, a multitude of risk factors significantly elevate the probability of a stroke materializing. These include elevated blood pressure, tobacco usage, diabetes, high cholesterol levels, and cardiac ailments. Vigilant management of these risk factors, coupled with the cultivation of a health-conscious lifestyle, is paramount in diminishing the susceptibility to experiencing a stroke. Furthermore, in cases where sudden and intense symptoms arise, such as speech difficulties, abrupt facial, arm or leg numbness or weakness, or an intense headache, swift medical attention becomes imperative. These manifestations potentially signal the onset of a stroke and necessitate immediate medical intervention. Thank you for taking the time to watch the informational video we've shared. If you find this information helpful, please consider sharing it with your friends and loved ones so they can benefit from valuable insights on stroke prevention. Don't forget to like and subscribe to our channel to be among the first to receive valuable health and nutrition videos. As always, we wish you good health, safety, prosperity, and happiness.